because it is on the front side. These two, come close. So and these two are the parietal bones. This one here is the nasal bone, and these two are cheekbones, which are known as zygomatic bone. So these two are zygomatic bone. This yellow is maxilla, and this is mandible. Now we go on the side. This yellow color bone is temporal bone, and in the back this is occipital bone. So we went through the skull and we have identified all those bones. For example, frontal bone, parietal bone, nasal bone, maxilla, zygomatic bone, mandible, temporal bone, and occipital bone. This bone here is hyoid bone. It is here in the neck area. Here is actually sternum. So this whole structure is known as sternum. Here are the cartilage where the thoracic ribs will attach. This is a rib actually. So this structure is a rib. Now we will look at three kind of vertebrae. So this is cervical. This is a cervical vertebra. Cervical vertebra has three foramen, one in the center and two on the side. So total three foramen. We can say this is cervical. Thoracic vertebra has the vertebral foramen in the center and it is round, whereas lumbar vertebra has the vertebral foramen which looks triangle shape. So cervical, thoracic and lumbar vertebra. Cervical has three foramen. Thoracic has the vertebral foramen which is round, and the lumbar has the vertebral foramen which is triangle shape. Now this one here, this bone here is sacrum, and the bone which is attached here, the tiny bone known as tailbone, it is coccyx. So I will show here. This one is coccyx. This one. So now we are done with the axial skeleton. Now I will start the appendicular skeleton. This is scapula. Scapula is actually known as shoulder blade. This is clavicle. Clavicle is collarbone. Then we have, here is humerus, and humerus is the bone in the upper arm above the elbow. Then we have the elbow joint is formed by ulna, and this is radius. So this is our shoulder joint, scapula, clavicle, humerus. See, humerus has a head which looks like a ball shape. So this is humerus. This is ulna. How to identify ulna? See this trochlear notch. You don't need to know trochlear notch, just for identification. Know this is ulna. This is radius. Radius has a round head. So if you connect these bones in your body, here in the upper arm you have humerus. So here will be this is, here we have the humerus. Then ulna is towards the pinky finger. So here is the ulna. And the radius is towards our thumb, is radius. So these were the upper extremity bones: scapula, clavicle, humerus, ulna, and radius. Now I will show you the bones for the lower extremity. So here, this is the pelvic bone. This is femur. See, femur has like a head which is looks like a ball, and it is the most heaviest and the thickest bone in the body. So this is femur. This is below the knee, tibia, and tibia actually you can feel even this medial malleolus if you palpate, move your hand on the ankle joint. You can feel this bump. So this is tibia and this is fibula. So these two are the bones, tibia and fibula, located below the knee. These are the leg bones. And here is patella. Patella is the kneecap. So femur, the thigh bone, tibia, the shin bone, and fibula, these are the lower leg bones. Patella is the kneecap. Now we will have here.
Wait, this was pelvis?
This is pelvis. Okay. So here is pelvis, femur, tibia, fibula, and the kneecap. Now, this is the bone which form the ankle joint and the foot. So you see, this heel bone is known as calcaneus. Heel bone is calcaneus. And now you see 1, 2, 3, 4, 5. These are metatarsals. These are in the foot. Then see, we have the digit. This is the big toe, and these are the digits. And each digit, like the big toe has only 2 phalanges, proximal and distal, whereas the other digits will have proximal, medial, and distal. You don't need to know proximal, medial, distal. You need to know these are phalanges, these are metatarsal, and this is calcaneus. So you need to know calcaneus, metatarsal, and phalanges. Now we will talk about the hand. Like here is the hand, wrist, palm, and the phalanges. So see, these wrist bones are the carpals, which are here in the wrist. Here in the palm of the hand are these metacarpals, 5 metacarpals. And see, these are the phalanges. Digits have the phalanx or phalange. Now, the last thing we will talk about, the infant skull. Infant skull has the soft spot like here. And those soft spots are known as fontanelle. So we are done with the skeleton. So please